It's a real pleasure to be here with you today. This presentation builds on the 2015 Design and Health World Congress presentation about the Lady Celento Children's Hospital Healing Gardens. The response has been amazing, rewarding, and encouraged us to deepen and extend our design agenda. We would like to acknowledge our co-author, Professor Jenny Ziviani, Children's Allied Health, Dr. Omniya Baghdadi, and Dr. Angela Reeve from the Queensland University of Technology. We would also like to acknowledge Lady Celento's staff, patients, and their families. We will present our industry-academia hospital partnership that has been working towards mainstreaming green space in healthcare facilities. This includes lessons learned from the partnership to revitalize health and tackle 21st century challenges. This is about providing quality of care, bringing the evidence to show the world what works and what may not. From our experience, we know too well the challenges of budget cuts and working in the absence of practical design indicators or guidelines. We also have experienced the opportunities and energy created through collaboration. In the following slides, we will highlight emergent design theory and share with you our planned academic research agenda. Please join us in our research journey, which we believe will transform design for health in years to come.
Since the 1980s, studies have increasingly indicated that green space in urban environments can benefit people's health. Within hospital environments, academic research has also indicated that patients may heal more quickly and with less medication if they're able to see or experience nature. But despite this progress, the literature also tells us that professional silos still limit the application of knowledge. Healing gardens are generally nature-oriented spaces that are designed to provide therapeutic or rehabilitative potential. There are many opportunities for nature to be integrated into healthcare facilities with the elements highlighted in this slide. Critical questions arise when we consider the evidence of the benefits that come from viewing or spending time in nature. We might ask, for example, what kinds of nature give the greatest benefits? And indeed, do all kinds of nature provide some benefit? How do you design a healing garden? Or indeed, what makes a healing garden? And how is a healing garden different to other outdoor space?
We now detail a timely journey of action research that has been underway for the last decade in Brisbane, Australia. 12 years ago, Conrad Gargett developed a design lens for the Department of Education to illustrate the complexity and importance of landscape design. It was not until years later that we discovered its usefulness in articulating the design and healing gardens in hospital settings. In 2007, a Conrad Gargett Lines venture was successful in the $1.4 billion Lady Celento Children's Hospital bid. The vision was to create a place for well-being based on evidence-based design and patient-centered care. We investigated how this could be achieved, considering national and international example projects. Surprisingly, in the area of landscape design and healing spaces, very little on green healing spaces emerged. The planning for green outdoor spaces still progressed, with a heightened awareness of the importance of this project demonstrating green spaces that benefit patients, their families, and staff. In parallel, two events occurred during the landscape design. Firstly, a colleague within Conrad Gargett introduced us to the proceedings of the 2004 World Congress for Design and Health, with a long list of references to explore. The second event involved coming across an evocative image showing the Sisters of Mercy taking a contemplative walk and convalescing in the hospital garden. The light and shade, the abundance of green, the use of local native vegetation, and the sheer tranquility and peacefulness captured our imagination. This image inspired the subsequent design and still today encapsulates the landscape design intent.
So fast forward to 2014 and the hospital opening, where two other events influenced the research journey. Firstly, Conrad Gargett captured a video showing the excitement of a satisfied client and the design team. This video proved to be invaluable in conveying the message of what had been achieved. The second event was Katharina reaching out to our design team, asking for access to papers that she couldn't quite download. As we engaged in a journey of sharing our aspirations, experiences and concerns with each other, momentum built. Subsequently, we've involved a number of local, national and international universities to help with our inquiries. Thinking creatively about how to progress our mostly unfunded academic research inquiry at that point, we engaged with PhD, Masters, Honours and undergraduate students, creating a low-budget and managed environment of research inquiry. We subsequently received seed funding through QUT, Griffith, Conrad, Gargett and through Horticulture Innovation Australia, which has helped us to demonstrate capacity to work together. We also launched a national biophilic urbanism symposium series with the support of Conrad Gargett, hosting our inaugural event in April 2017 to enrol others in our collaborative journey. In 2015, we began to uncover the business proposition for mainstreaming healing gardens through understanding who is using these gardens and whether the gardens are actually meeting user needs. Through the first Bench Diaries project, we began to see the need to understand the mechanisms by which nature experiences influence human health and well-being. In 2016, we undertook an in-depth inquiry into the 7-year design journey of the hospital, interviewing colleagues from all parts of the design team. We distilled 3 factors important to address when attempting to integrate healing gardens within complex infrastructure projects, including capacity, expectations and vision. We're now collecting data responding to common questions from industry and the hospital relating to shading in the gardens, temperature, vegetation and its effect on temperature and humidity, and perceived comfort thresholds of the gardens for patients, their families and staff. Ethics approvals, while lengthy and time-consuming, foster rigour in our inquiry and are helping to build those deep relationships within the hospitals themselves, which is critical for collaborative partnerships. We're also gathering broad cost-benefit data in healthcare and urban settings regarding how such gardens might contribute overall to improve the local microclimate. This includes the use of environmental sensors to look at solar radiation, humidity and temperature, and how the gardens are affecting those key comfort indicators. We've just completed data collection considering the end-user experiences of allied health therapists. These insights can be transformative, potentially calling for action to reform stakeholder consultation during the design and the handover processes.
The evolving research journey has led us to realise the importance of community of practice that brings together the divide as illustrated here. Currently, there are many players in the built environment applying their knowledge and skills to a wide array of receiving environments with a multitude of healing garden intentions. However, they are largely ad hoc, champion-based and highly variable in the absence of a cohesive, evidence-based professional standard. With this in mind, we now present an appetizer for our research findings to date, building the foundation for such a standard and maintaining green infrastructure in healthcare. The framework for healing gardens is complex and includes theoretical and practical design knowledge. Responding to the need for competent transdisciplinary teams, we have developed a biophilic and salutinogenic approach as shown here. The design approach is a precursor to the design and assists in the understanding and support of the client, the design team, and other decision makers. Design is the process of taking an idea into a physical form. To the need for a structured pathway for this in healing gardens, we have developed a landscape design lens to guide the process of landscape design. The design lens shows a holistic approach and puts the patient and intent at the centre. While the intent has a clear outcome in mind, it can be expressed in different ways, showing the hand of the designer, and is influenced by the process, the media, the context, and the creativity of its originator. Responding to the need for direct inquiry within this organic environment, we developed a process for healing garden design, starting with a clear articulation of the intent, followed by a considered design approach, which is analyzed and synthesized through the design lens into a holistic design outcome. However, knowing how to go about a design process is not sufficient without appreciating what makes healing gardens work. We are ultimately seeking to create normal environments that benefit patients, their families, and staff. We have identified 6 emerging design principles based on data collected, the literature, design philosophies, theories, examined healthcare models, and learnings from the design and implementation of the Lady Salento Children's Hospital.
Looking ahead, we know that people value quality healthcare, and we can see that healthcare spending is steadily increasing. However, we're keen to see the investment of funds into biophilic and salutogenic infrastructure to encourage disease prevention and ultimately well-being. With this in mind, we need to be innovative and strategic with prototyping and piloting healthcare innovations, underpinned by good quality research, randomised control trials, and evidence-based design. Connecting with our emergent research slides earlier, our planned research agenda then focuses on investigating how the built environment professional sector can best create healing garden environments for different receiving environments, exploring the potential for biophilic and salutogenic theories to improve wellbeing outcomes, and refining the landscape green infrastructure design lens and design approach across multiple receiving environments. Considering health infrastructure within the context of Healthy Planet, we are committed to globally connected research relating to refining the normalcy in healthcare green infrastructure design principles, expanding the research to other design healthcare settings, engaging with digital data capture and analysis tools to liaise with our research colleagues internationally, and in this way contributing to mainstreaming green infrastructure in healthcare settings. This research agenda will provide us with the much-needed in-depth understanding of economic, environmental and social performance of gardens in hospitals.
In conclusion, healing gardens play a critical role in patient care and staff well-being. We observe an increasing appetite for biophilic, nature-loving solutions in the healthcare sectors, with health experts wanting to know how they can incorporate nature into new and existing healthcare infrastructure. Given the complexity of the healthcare industry with many dimensions and stakeholders, a holistic approach to design and implementation is critical. Our research agenda is expanding from hospital to green infrastructure in the built environment. We actively seek to engage globally with healthcare and design professionals to work towards achieving our ultimate goal. Our ultimate goal is to provide better quality for humanity on planet Earth. Can you see that last paragraph here?